Okay, I think I'm going to start right now, and I won't hold you up, especially if you're on your lunch hour. Good afternoon, everybody, and we are so thankful that you joined us today. My name is Nancy Scott, and I'm the Education Project Manager at Dialysis Patient Citizens Education Center. Joining us today is Elizabeth Jones. She's someone that I have known for, I think, almost 20 years now, and she has an extensive background in social work. She has a lot of um, alphabet behind her name, MSW, LCSW, FNKF. She is a nephrology and transplant social worker for Walter Reed Medical Military Medical Center in Bethesda, Maryland. She's been a nephrology social worker since 1991. So if I calculate correctly, that's about 32, 33 years.
Exactly.
Yeah, and she has worked in the hospital, she's worked in physician offices, she's been in outpatient settings, and when I met her, she was at DaVita as a facility administrator. And if you're in Fresenius, that's equivalent to a clinical social worker or clinical manager, actually. She was actually the manager of the whole place. So Elizabeth, I'm just real excited about your new venture. You're working in a military facility, helping veterans, and they're giving support to family members of the veterans and the whole nine yards. So why don't you tell us a little bit about anything that I did not mention?
Okay, well, I think you mentioned it pretty much all, Nancy. I've been a nephrology social worker for 33 years. Hard to imagine that. I was assigned to work in nephrology social work in a hospital 33 years ago, a very large 1,500 bed hospital in Houston, Texas. Then a few years after that, I went to work for a group of 4 doctors, and they had another doctor in practice with them. And they had 207 dialysis patients. So that was my first, left the hospital and went to the outpatient dialysis. In the hospital, I'd worked with a kidney transplant, kidney pancreas transplant, the endocrine service, the renal service, dialysis facility, and the inpatients and outpatients at that hospital. Then I went to the 207 outpatients in the community in Houston. And that was an extremely large dialysis center. And I was the only social worker in the beginning. We did end up hiring another because 207 was quite a few patients and wanted to serve them the best we could. Then I was, the doctors sold their practice to a company that merged with another company, which eventually became DaVita. And then I moved back up to the DC metro area where I'm originally from with DaVita, stayed with them for a long time. And then I guess last July, so not too long ago, I switched to Walter Reed National Military Medical Center here in Bethesda, Maryland, where we have our active duty military and we have our retired military. And through the transplant program here, we have a share agreement with the Veterans Administration where we also work up veterans for transplant and serve them. So yes, it's great. It's a great variety and a good change. And going back to the hospital from kind of what my original starts at a hospital. So nice way, hopefully my last decade of my career.
Wow. Now, do you see a significant difference in working for a facility that is not military in reference, in comparison to a military facility?
I think there are a lot of differences. So this is a teaching hospital here. So we do have, similar to when I worked in Texas, it was a teaching hospital, but civilian. So I think hospitals are different settings than outpatient dialysis settings. So, but there's somewhat of a difference, but the military just has more structure, I would say, but not very different than another teaching hospital in a community.
So what would you say, Elizabeth, is the primary role of a renal social worker?
So I think the primary role of the renal social worker is to assist the patients with all the complicated medical information they're receiving and help them fit that into their lives so they can live successfully with kidney disease.
Now, I've noticed, because my background, I was on dialysis for 7 years.
Yes.
And I've been transplanted now for 13 years. I noticed when I was in a facility that the social worker was spread very far. They may have had two facilities to go to and take care of patients. How do you manage that? How are you organized enough to make sure you reach out to every patient?
So personally, what I think if you're in a community dialysis setting for a social worker, I think the best thing to do is do weekly rounds. Even here at the hospital, I have a small dialysis center of
Mhm,
patients, and I'd like to round on them weekly myself.
mhm,
It's good to do the group rounds with the doctor and the dietitian and the rest of the team too. But I think those individual check-ins with patients once a week are
mhm,
invaluable, just to see if they need anything, and also to make sure that they have your phone number, they have your email, so they can contact you. And their families want to contact you also. That's so very important.
mhm. Well, we have a support group at Dialysis Patient Citizens once a month, and you have also been a guest on that as well. I've noticed that, and we don't have complaints or anything online. We're merely there to feed off each other and to help each other and to get through this journey that we're on. Um, I've noticed that oftentimes the patients will not open up to social workers. They don't see that as a vehicle to help them manage this journey. How do you reach out to a patient like that?
So what I like to do is provide resources. So I'll just develop different resource sheets or information, and I'll hand them out to a lot of patients in the facility, maybe not just the patient that I thought might benefit from it.
Hmm.
And I'll say, this is something that might help kidney patients. Like recently, I just did a listing of all the kidney organizations that I could think of, and I handed that to my patients. And some patients, were more receptive to it than others, but other patients were like, oh, I might give that to my wife, or yeah. And one patient said to me, which I really took to heart, he said, kidney disease can feel so isolating. So he really,
Right.
really appreciated having that list. But I handed the list out to everyone, not just the patients I thought might be interested in some of the things on it, but then in particular, I pointed out to different ones. And I even had patients say to me, hey, what about the Polycystic Kidney Disease Foundation? And I had not put that on there. So I'm going to add that to my list now.
Absolutely. Absolutely. Now, you know that I'm also an advocate for mental therapy for renal patients. And do you work closely with the mental therapy department at Walter Reed, or is that something that you're really not affiliated with, or how do you
Yeah.
handle that?
So it's exciting here at Walter Reed. All social workers are part of the behavioral health department, which is wonderful.
Yes.
So we all benefit from training and resources with each other. There's those of us in the outpatient setting. Then there's social workers that work in the inpatient setting, and then there's social workers that work more directly with the psychiatrists and the behavioral health in that sense. So there's a lot of different opportunities and a lot of different avenues for us, but we're all part of the behavioral health department. So
Oh,
we all get that good training, and we're all fully licensed,
okay.
and it's a wonderful experience.
Wonderful. Now, recently we had a psychologist on our support group, and we discussed the fact that now that Medicare pays for psychologists, because every
Yeah.
dialysis patient is on Medicare at some point. And we were saying that even though they pay for that now, there are not a lot of psychologists that sign up to treat renal patients. Is that a problem in the military facility as well?
Um, So some of our patients have Medicare, some of our patients have TRICARE. It just kind of depends, or some of them have both. And like you said, renal patients at some point of their lives, a majority will have Medicare
Mhm,
at some point.
mhm,
TRICARE itself, the insurance will help them find a provider. They have lists we can look up. And then Medicare also, if you go to Medicare.gov, you can look up providers for almost anything
mhm,
nowadays. And you can put in a patient's, or a patient themselves in Medicare.gov could put in their own zip code or their own hometown and state, and then it'll pull up all kinds of providers. Now, if you're out in the rural area more, I was helping a patient the other day for a certain provider we were looking for. There were only 4. But for another patient who might be in a less rural area, there might be hundreds. So it just really depends on the provider. And it depends, too, how many miles you're willing to travel. But
mhm,
the good thing is nowadays, since COVID, a lot of things can be done telehealth. So,
mhm,
what I was noticing on the Medicare.gov site was a lot of the providers said if they provided telehealth. So I thought that was a really great addition to see.
mhm. Now, will any of the social workers ever go out to a patient's home?
I think through home health agencies, that's usually a social worker can come out if you're having home health and there's a home health need. And then patients that are on home dialysis, the social worker may be coming out with part of the team at certain intervals.
Okay. Now, one of the things that I found very helpful with a social worker was the fact that when it was time to travel,
Yes.
they played a major role in that.
Yeah, so
Is that,
it depends. Yeah. Sure.
and when you say it depends, what do you mean?
So in the larger corporations, the LDOs, large dialysis organizations nowadays, a lot of times there are these 800 numbers for each of the companies that you can call, and they'll help you make your travel arrangements, and then they'll send an email or a fax to the facility, and then the administrative assistants now, typically nowadays, sends out those records.
Okay.
Here at my facility, I do work in the hospital. We do work more directly, the social worker with the patients with the travel arrangements. So it really just depends on the organization and how large they are and how much support there is.
Okay. Now, do you find that more people travel with the military than they do with the outpatient facilities, other outpatient facilities?
No, I would say travel it's the same. I mean, everyone has weddings or births or graduations or vacations or family they want to go see. So I think it's very similar in all settings.
Okay. Can you tell me a memorable moment when you really know that you got through to a patient to help them?
Wow, that's a hard question.
No, you should have many. 33 years, you've got
Yeah,
a lot.
I know.
You're
I've
just
been
being humble. You're being humble.
Yeah, yeah, I just like it when patients, when I see a patient doing really well. I guess one of my best memories was a patient who got their citizenship. Got their citizenship on, I think it was Thanksgiving Day. Or wait, no, they got their citizenship and then they got a transplant on Thanksgiving Day.
Mm-hmm. Well, I remember when I got my transplant in 2011, and my social worker came to the hospital to see me.
Yeah.
And out of all of my visitors, that was a visit that I'll never forget.
Yeah.
And you have those kind of journeys when you're on dialysis and you go to transplant. And I want people to realize that the social worker can be their new best friend when you're on dialysis. And I have mad respect for social workers because it's not a good idea to get on their bad side because they're constantly trying to help you behind the scenes, whether you know it or not. Um, the only thing that I have a problem with is that when you're in center, there's not a lot of privacy.
Correct. Yeah.
And
You're right.
sometimes patients really want to tell you something that's really, really private.
Yeah.
And they don't want anybody to hear them. How do you handle those kind of situations?
So a funny thing, sometimes I would receive a call in my office and it was a patient who was on the dialysis machine. And I'm like, Mr. Jones, aren't you out there on the dialysis machine? And Mr. Jones would say, yeah, but I just want to talk to you and I want anyone else to know. I'm like, oh, okay, that's fine.
Mm-hmm.
So we could talk. They were comfortable on their cell phone there. I said, or do you want to come back to my office before or after a treatment? I can meet you in the waiting room, the conference room. Some facilities have huddle rooms. So there's lots of different ways you can offer a patient to meet. Or when they go home, do they want to call you and talk about it? Or call them.
Okay.
So I think it's just whatever works for the patient. I think most social workers are pretty flexible about, and we try to accommodate.
That's great. That's great. I wanted to know, I'm going to look to see if any of the people on the line have a question for you.
Sure.
And I don't, let me see.
I did have one interesting statistics because we were going to talk about veterans.
Sure.
That veterans were more likely to have kidney disease than the general population. I was trying to find the exact statistic here. I believe it was 36%, but I don't want to misspeak on that. And then I can send you that reference afterward. Yeah, 34%. So according to the National Institute for Digestive and Kidney Disease, veterans are more likely to have they're more likely 34% higher than the general population for kidney disease. So that's a pretty high number.
Really? And what do they attest that to?
I did not see that, but I just thought that was interesting. But I'm happy to send you this information.
Okay, that's amazing. I wonder, would you think that diet may have a lot to do with it, or stress, or?
Yeah, I'm not sure. I don't know the reasons. Yeah, I don't know what's correlation or causative with that.
That's
but that might be
interesting. I'm going to check that out.
On, right?
Yeah, I'm really going to check that out. And it's good that they do have a facilities for the veterans.
Yes, they're
Because,
wonderful.
yeah, it is because and especially you're right there near DC, in Bethesda. So I'm sure that you're getting people from Virginia and
Hmm.
Washington and Maryland
Right,
and
right.
probably other
Too.
surrounding
Even West
areas, right?
Virginia, right? All the
Okay.
all the, yeah.
Now, when did that facility move from DC? Many years ago, am I
Oh,
correct?
yeah, it's been a long
Yeah,
time. Yeah, I'm not sure the
yeah.
exact date, but
Mm-hmm.
uh,
Well, Elizabeth, I am really glad I didn't plan for this to be a long live
yeah.
because I knew that, we could get this information out. But I don't even know if people know that exists, that there are actually renal and transplant social workers in military facilities.
Right. Several veteran administration facilities do actually have transplant programs. So if you're a veteran, I highly encourage you to enroll at your local veterans center and then learn about what resources are there for you. There's mental health resources, there's case management, there's some facilities have dialysis centers, and some have transplant programs, and then they may also be able to refer you to our transplant program here at Walter Reed.
Absolutely,
And then
absolutely.
if you become a transplant listed person, there's an organization called Dove, DOVE, that helps veterans find donors.
Really?
And it's a fantastic organization.
Mm-hmm.
Their website is dovetransplant.org.
Okay. DOVE,
Mm-hmm.
transplant.com.
.org. O-R-G.
I'm sorry.
Okay. And I can
I
send you
should
some
know
information
that.
on that too, Nancy. And I thought I was looking at their webpage earlier today, and it had a really cool thing. I thought it has links and resources. So it's struggling to qualify for organ donation is on here. So maybe it can help a patient prepare so they can become a candidate. Also, there's some educational information on here. You
Mhm.
need a kidney transplant, but not sure how to apply. I just thought some of these questions were really compelling and very helpful for
Yes,
patients.
yes. What other jewels can you give us? I have to use you while you're here.
I just think all the patient organizations are great. I think there's different things from each one that may benefit different patients and their families. So I think that's just another good thing. And I'll send you the list that I've compiled so far. And I don't know, maybe there's something you think we could add to it. Of course, we have dialysis patient citizens on it, as well as many of the other
Okay.
organizations in the community.
And I will share that with the DPC staff
Yeah.
because they get calls all the time about different things and any resources that we can get for patients because we're all about impacting quality of life and helping people on this journey. And it's a journey that many people don't understand unless they're on it or directly involved with people. But it used to be years ago, you didn't know too many people on dialysis. Now you can have 10 people in a room and 3 could be on dialysis. So it's real important to get all kinds of information because when you know better, you do better.
Yeah, and
And
Medicare.gov has a fantastic nowadays that you can look up dialysis centers where anywhere and see what the quality of it is, all kinds of information.
yes, and we have to try to keep it positive because there's so many myths that are not correct at all. And that's one of the things we try to do at DPC is give positive information and not, if we don't know the answer, we research it. So,
Exactly.
and that's the best way to do it. I don't see any questions. I think we must have a lot of real smart people on this live. And Elizabeth, I cannot thank you enough. Every time I reach out to you, you help me out, and we appreciate it. We really, really do.
Well, thank you,
And
Nancy. Always great to talk with you.
okay, and thank you, and you have a great
You
week, okay?
too. Okay,
And
bye-bye.
thank you, everyone who joined. Have a great day.